When it comes to administering that much-needed vaccine, the Trump administration promised more than 20 million doses would be given out before the new year. With 1 day to go, the CDC says just a fraction of that has made it to the front lines. To be exact, only 2.1 million doses have actually been administered.
In Maricopa County, the state's largest county, only 36,000 healthcare workers have gotten their shot, less than what was estimated by this time as well. So tonight, Governor Doug Ducey issuing an executive order changing how they're being distributed across our state.
The governor saying in a press release, vaccines don't do any good sitting in a freezer. As ABC 15 reporter Nicole Grigg explains, that new executive order directs the Department of Health Services to implement a state-run, top-down approach in hopes of speeding up the process.
ABC 15 has been asking for days about the slow rollout here in Arizona. Out of the more than 300,000 vaccines the state will have by the end of the week, just 20% have been used. That's likely why the governor is issuing an executive order.
So what we're looking at is taking more of a state-directed approach for allocation. So really looking at our county health departments really know their community providers the best. But knowing that some of those more statewide entities like the Walgreens, the Costco's, the CVS's, they need to work on a statewide basis. We'll be allocating some of the vaccine directly to them as it becomes available.
But in a press opportunity, the state's top public health director was asked repeatedly why the rollout has been so slow as we're now 15 days in.
We are working with our local health departments to look at ways to increase that vaccine. Some of that vaccine just came in a couple of days ago, so it's constantly coming in and going out, but we're working on getting additional vaccine out.
And before the governor issued that executive order saying that vaccines do not belong in freezers, Maricopa County invited us out to one of their pod locations. They say this location today, they're doing up to 400 people an hour.
Reason for having today was really to showcase this is what it looks like. This is how it should be operating. This is our intent. This is what we've planned for months and months to make happen.
We were not able to ask Maricopa County's top public health director about what this new executive order will mean for them, since we saw her before the governor issued the new order. But I did ask if they think it would be better to have a uniformed approach.
When we plan for pandemics like this, it always is a coordinated approach, but it's nice to have local public health kind of running how it happens in our community. So ideally, it would be amazing if there was a national program that all public health departments spoke to one another, that spoke to our healthcare system, and that just doesn't exist anywhere in the nation.
As for when will we start moving into the next phase, 1B, each county will get to choose when to move forward, but we should expect those in 1B, like teachers, by the end of January. In Chandler, Nicole Grigg, ABC 15, Arizona.